Good afternoon, everyone. I'm delighted to be here. My name is Jill Swartz. I'm the Chief Product Officer of ZEO ScientifiX, and I have the pleasure of being with Dr. Carolyn DeLucia here today. Hi, Dr. DeLucia.
Hi, Jill.
We're here actually to do a patient education talk on exosomes and the different approaches to a lot of the things that Dr. DeLucia does in her practice. And I wanted to just give a sneak peek to your patients because you're so humble that they don't really know all of the wonderful things about you. So I just want to give you a quick introduction and then let you take it away. And I'm really, as I said, I'm just delighted that you are taking the time to educate your patients on the newest and greatest things. But for those of you who may not know, Dr. DeLucia, of course, is a board certified OBGYN, but she is actually one of such a specialist in demand in this whole regenerative, anti-aging, functional space of medicine. So she's really a pioneer, sort of paving the way into this very uncharted or newly chartered area. She's also developed a lot of her own combination therapies and protocols and different techniques in her practices. And she's also an author of 2 Amazon best-selling books, one called Ultimate Intimacy and The Ultimate Connection. She's also contributed to some latest best-selling book by Tony Robbins, Life Force, and many other women's health publications. So without further ado, I will let you take it away, Dr. DeLucia. But again, thank you so much for taking the time out of your busy day to help really educate your patients. It's really kind of you.
Thank you so much. It's what I love to do, is to share especially the newest and greatest information. And I feel like my patients want this. They are looking for ways to stay healthy and live their best lives as we go forward. And I try to keep on the cutting edge of what's available in science and in this world today. So I'm so excited to share the newest approach to sexual function, hair loss, and joint pain. Many issues that we have and encounter every day as we grow older. And our topic today is the newest cutting-edge frontier of regenerative medicine, and that's exosomes. They are these small vesicles, personalized regenerative medicine. They are a category of cell-derived membranous structures that carry incredible message from one cell to another. Exosomes are a class of extracellular vesicles released by many cells in our body. The key function of what we use them for is to decrease inflammation and to promote cell growth, regeneration, and healing. That's the magic word, healing. And it's present in all our body fluids. Exosomes range, they're teeny tiny. They're 40 to 160 nanometers in diameter, and they carry something very special that we refer to as microRNA. And that these carry over 300 bioactive contents, DNA, RNA, lipids, metabolites. These tiny vesicles, as you see in this little recreation here, are released into the extracellular area, and we can collect those and use them to regenerate tissue in our own body. There's nothing more fascinating than harnessing the power to help our body heal itself. So harnessing that power of exosomes, these tiny powerhouse vesicles can specifically target damaged and inflamed area and regenerate it at a cellular level. And this is the goal of recreating healthy tissue. So how does it work? Exosomes transfer the molecular information between cells. It's like sending a letter from cell to cell. And in that letter is a message. That message triggers the next cell to either make or not make, or do or not do a certain function. And in that, what our body does is it has an immune response, wound healing, metabolic regulation, cellular differentiation, cellular regeneration, and regulation of gene transcription. This is the key factors of recreating tissue in ourselves.
And I think Dr. DeLucia can say what's so fascinating, as you said, and the human body is just it's just so remarkable, but that these little vesicles actually can be placed in the body and find the areas of inflammation, and they just know what to do. So
yes.
I just said kind of really on this patient level, that's what I find so fascinating, that it can just really target anywhere, which is about what you're about to talk about.
Yes, yeah. I call it honing device. It finds its way. So we can, as I'll go on later, but we can put them intravenously right back into you. And that kind of is confusing, because if we take it out of your blood and we put it right back in, what does that do? But in high concentration with their honing devices, they're on a mission. They're on a mission to go to where they are drawn due to inflammation or injury, and bam, they go into action. And that's the miracle of an exosome. And I can't hold back my excitement with what this has done for me and for my patients already. So what kind of inflammatory diseases can we attack here with these exosomes? Well, we can use it for brain function, lung diseases, chronic lung disease, liver disease, skin problems, eye degeneration, maybe in the future even improve eyesight so we don't have to wear glasses, or heart disease, kidney disease, intestines, bones, and the only thing missing from this slide is sexual function. So that is because very often it's taboo, but not in my office. We talk openly about maintaining our intimate connections. So how can I deliver these to my patients? Many different ways. We can use them directly into joints and into an area of, let's say you have a shoulder that has a torn rotator cuff. It could help heal. It may not do the whole trick, but it certainly could help. Systemically IV with that honing device that I love to illustrate, and local injections into our genitalia for sexual function painlessly. No one panic. I've got that settled and covered, but use it for wellness and hair regrowth. Topical applications, we can use these topically, and it can be used for aesthetic purposes. We can use it with microneedling, inhalation, actually using it as a nasal spray is being developed, or as an inhalation agent, as also triggered by a special virtual type of ultrasound that brings them to the brain. So the work being done in this area is absolutely astonishing. PPX is the latest and the greatest of the use of exosomes. What is this? It's autologous. And what that means is it is your own. And that's what makes PPX unique. There are many companies in the United States that are using allogenic exosomes. Those are exosomes from somebody else or a plant. We just don't know for sure if that might cause a problem. So the FDA has those products strictly used topically. You cannot inject them. You cannot put them in genitalia. You cannot put them intravenously. But that's not the case with autologous exosomes. These are your own, and I can take them from you. I'll explain the process in a few minutes and create your own concentrated, valuable liquid gold that we can give back to you in a way that you may need it in order to heal your own body. So once they're exosomes, we can place them back, and these powerful vesicles target damaged cells and promote your tissue healing and regeneration. So how PPX works? You come into the office, I draw your blood, and it is sent to an FDA certified manufacturing laboratory in Florida, where they have devices that I could never fit in my office. Super high-tech centrifuge that spins down and processes your blood after screening it for everything, despite the fact that it's coming right back to you, and concentrates your own exosomes into 2 1 vial doses. They're tiny and they're frozen. I keep them frozen in the office until we are ready to use them for you and your personalized treatment. Is it safe? That's the first question anyone's going to ask. The best thing is that it is autologous. It's you concentrated, given right back to you. That eliminates an enormous amount of complications and worries. So it's highly favorable safety profile. It's acellular. It doesn't contain any cells. It's just a membrane with that magic message. And it comes from your own body, processed, cultured for microorganisms in that fancy schmancy. You got to take a tour of this place. FDA registered, certified laboratory, and no risk of infection.
And I think your patients might want to know too. It's similar, that process, to like PRP, but what's important for your patients to understand, and just consumers in general, right? Because there's a lot of misinformation out there. This is like the next level of PRP, right?
Yes.
And then people will ask, oh my goodness, well, if it's for my own self, what if, and I'm older, how do those, those exosomes work? It's really important that they understand this is something that's processed in a way that can't be done in the office, right? And that the studies are finding that head to head, right? It doesn't matter. I would love you to explain that to your patients, because I know they want to know, how it compares there. And what we're learning, that it's not age dependent.
Right.
These exosomes.
That's the key. So PRP, which is platelet-rich plasma, which is a very wonderful portion of our blood. It comes from our serum and it contains platelets. And what we've discovered is that with the PRP, inside our platelets are growth factors that burst open and release a signal to activate other cells. But what we're figuring out is that active growth factor just may be the platelet's own exosomes. And when we isolate just PRP in the office, we could never hyper concentrate it to the degree that is done with PPX. And that PPX is next level PRP with the platelets used to isolate and concentrate those special nanoparticles from your PRP. And that is way way for future generation frontier
Yes,
of
yes.
regenerative healing. And that's the magic here.
And that's the real liquid gold you were talking about, you know, the
Exactly.
400 billion particles of liquid gold. Yeah,
That's correct. And that's
thank
never
you.
possible in an office. And even if you try to produce exosomes in the office, there's no way you could do it without the hypercentrifugation or adding enzymes or something that the FDA does not permit. And it also would never be able to be quantitated. I could never promise the quality I can assure you of in a PPX product. And that's what sets it apart. And I'm blessed to be one of the early adapters of this therapy. But trust me, everyone's going to get on this bandwagon because it's just that good. I healed my own osteoarthritis. I regrew my own hair, and I don't think I'm lacking any now. So
Amazing. Yeah.
I'm pretty happy with these results. So what clinical use is right here? Osteoarthritis, like I mentioned. I didn't stick it into the joint that was aching me. I gave it to myself intravenously. And there's a study going on right now promising that that seems to be even more effective than putting it right in the joint, just pushing it right back into your vein. And that's very painless. Intra-articular, right into that joint, it could hurt a little. So I'm thrilled to be able to offer it intravenously. And for any sport injury, any wound healing, hair loss, like I mentioned, and the beautiful aesthetics and sexual medicine. And I'm going to get a teeny weeny bit into sexual wellness for 2 seconds here. Sexual wellness options for women. There really have been so few. If you go to any obstetrician gynecologist and you have vaginal dryness or painful intercourse, they will offer you a local estrogen. And I offer that too, if that's all you would like to try. But that's mediocre to poor in response and efficacy. It makes it tolerable, and it does nothing for actual orgasmic response or arousal. So, searching for other answers, I stumbled upon PRP, and that's wonderful and very effective, but you use and do the similar procedure like the O shot using PPX, oh, you're at a whole nother level. And I'm thrilled to be able to offer this. And I've already started the clinical trial with this in my office. And you could also call and ask if you'd like to be part of that. But that clinical trial is ongoing, and I am seeing staggering responses by using PPX to regenerate the ability to achieve orgasm that minimizes or may just be so delayed that some women just go ahead and fake it because it's taking so long. So we don't want that to happen. And we can treat that. These are now treatments that work. And for men, erectile dysfunction, extremely common. And it's up to 40% of men have erectile dysfunction, and it's happening more and more in younger men, younger than 40 years old. And there's nothing to be ashamed of. And especially there's a way to treat it. And if we can do something painless and it's your own body helping heal yourself, it's unbelievable. So being able to maintain erectile function and to be able to hold an erection, be able to have a firm enough erection for penetrating intercourse, not have premature ejaculation or delayed ejaculation, which is also extremely frustrating for men. And the secondary benefits of improvement in prostate issues and maybe a post-urination dribble or waking up in the middle of the night. I am seeing improvement in all these areas in treating men with PPX. It's Unbelievable.
And I think it's just so nice to unapologetically be able to have this conversation. I mean, people are suffering from this, right? I mean, and to know that there's a solution. So my kudos to you for having this candid conversation, because they need to know there's options. They really, really do.
Yes. 52% of men suffer some form of ED. 57 of those reported ED are between the ages of 40 and 60. 80% of ED goes unreported because both practitioners and patients are not comfortable to discuss it. Not my problem. And I'm happy to discuss this openly. And a patient's husband called me thinking that I could only treat her the other day and said, I'm looking for a male version of you, or someone who would treat a male the way you treat women. And I said, come on, come on.
Great.
And he just didn't realize, because it's not evident that an OBGYN would be treating men, but I treat partners, and it takes two to tango. And I wanted to quickly show that this is not made up as far as improvement in blood flow to the penis. And this is what we call a Doppler, showing blood flow and decreased ability to hold it. And right after the PPX, within a month's time, we see great improvement in that function. Wow. And with that increased blood flow into the penis, erectile function improves. And for women, our anatomy is just mini male anatomy. We've got the same stuff, it's just a little smaller, but equally in need of improved blood flow. So we're seeing these amazing benefits. We're seeing decreased pain with intercourse, improved urinary incontinence, younger looking skin on the external area, improvement in the tone and texture of all of the vaginal tissues. And in men, like I mentioned, improved blood flow will fix the firmness of the erection and the ability to maintain it and have sexual stamina and please each other in a very healthy fashion. So I invite all of you to give me a call if you want a consultation, and don't suffer in silence. And thank you for your attention.
Yeah, thank you so much, Dr. DeLucia. And I wanted to say to your patients, stay tuned, because this is an ongoing initiative that Dr. DeLucia is committed to helping educate our patients. So I just think it's very commendable that you would take the time out of your busy schedule to make sure that we understand and get a little sneak peek into the education of this very some of these conversations are hushed, but medicine is advancing so fast. So it's so nice to know that we can, have these solutions. So,
exactly.
Yeah.
Amen.
Well, thank you. Well, be sure to tune in, and yes, and we will check back in a month or so, and perhaps that we'll have another topic to talk about, like hair loss, because I know you did that treatment specifically, yes. And we're seeing lots of improvement there. But that will be wonderful. Okay, well, have a lovely day.
Thank you, Jill.
Thank you. Bye-bye.
Bye.